Let's welcome Executive Director of YWCA Niagara Region, Elisabeth Zimmerman. Nice to see you today, Elisabeth.
Nice to see you as well. Nice to see people.
It is. These days, we don't get to see enough of people, that's for sure. Let's talk about a big announcement last week. Let's start by that, by looking at that. $100,000 donation from the McBain family to the YWCA Niagara Region. That's quite a significant donation.
It certainly is. We were just totally taken aback by this donation and the interest in the work that we do. So it was just totally took us by surprise, and we were absolutely thrilled. Absolutely, this is going to go a long way to ensure that we are able to provide the level of service that we need. It helps to offset some of the funding losses that we're facing right now. And so it's been really significant for us.
Looking at those funding losses, what kind of dollar figure would you place on that?
At this point, the potential is, I think, around 50,000, just in terms of funding that goes towards our Niagara Falls programs. We're not sure yet. I think time will tell the full implication of those funding losses. But one of the heavy things that we rely on is, bingo, some third-party events, things like that help to fund the programs that we provide. And of course, at this point, third-party events aren't possible. These are significant losses to ensure that we're providing this, able to provide the services. So this donation will ensure all of that, as well as help to, provide some extras. Right now, we're working towards arranging video conferencing for healthcare, but we need a computer for that. There's things like that we'll be able to purchase that we otherwise wouldn't have had the funds for.
Just to be clear, the McBain family from Niagara Falls, will this $100,000 be mostly for Niagara Falls services and programs?
Yes, it will. That was the agreement, that we would be looking at ensuring that our Niagara Falls residents are, have the services that they need.
Elisabeth, during this COVID-19 pandemic, there's been a lot of talk about supporting frontline workers. That's become a phrase that everyone talks about, frontline workers. And
Yes.
Most people, when they close their eyes and envision a frontline worker, they're thinking of healthcare. But
Yes.
you have frontline workers at your shelters.
Absolutely, we do. And they have been just absolutely amazing and have continued to ensure that we're being able to provide 24-hour services, in a closed-in environment. It's a communal living environment where we have women with, complex issues, and they've been incredible in terms of their commitment and ensuring that, the people staying in our shelters are safe and have the services that they need.
Were you forced to reduce the number of staff members at the shelters? Was there any changes that way during this time?
No, because we're single staffed, so we can't. What we have done is, as many people are working remotely, so any staff who are providing like transitional housing supports, things like that, are working remotely, because we didn't want to increase the likelihood that a staff member would bring in COVID-19 to the shelters. So we're trying to work as remotely as we can and reducing the risk.
Are your shelters at full capacity right now? Is there a waiting list? What kind of numbers are we looking at right now?
We're at full capacity, which would be, I think altogether, we're looking at probably about 65, 75 people that are sleeping in one of our shelters. I think it might even be higher, actually. With our family shelters, varies a little bit because depending on the size of the family. At this point, it's working okay. I think the longer this takes, or as things loosen up, we're going to see an increase in need.
These are challenging times for kids who are now expected to keep up on their schoolwork during COVID-19 shutdowns of schools. Are you providing supports to help the parents who are in the shelters with those tasks with their kids?
We're doing what we can. Again, it's limited. We don't have all of the resources that we need necessarily, but where we can, we're absolutely supporting.
If people want to contact you if people want to make donations? What's the best way?
Connect through our website. You can donate directly through the website. There's information there, contact information for people if they want to get a hold of me. My contact information is on the website. Right now, email's the best way. If they have questions or concerns or anything that they want to know, please don't hesitate to reach out.
Thank you very much, Elizabeth. We appreciate your time this morning.
Thank you so much for the opportunity.